So a lymph node examination is another thing that's undertaken, but that is the sort of thing that is definitely phased out over time. And so it's useful and essential, really, that you know how to examine your own lymph node groups. So the lymph system is all over the body. So I often get the question, particularly the sentinel node question, if I take out this lymph node, how does that affect me? But you've got lymph nodes all around your body. It's all connected. Some people describe it as the sewage system or the garbage system of the body. It basically takes out all the cells that it filters out all the cells that your body doesn't want there. So bacteria cells, fungal cells, viral cells, inflammatory cells, cancer cells. They're all filtered by the lymph system, which is why when you get a sore throat, you feel the glands in your neck. And it's why if you get athlete's foot, you might get a swollen gland in your groin. So they're not a specific cancer filter. They just filter out all the rubbish in the body. Now, particularly for the skin, you have to think about your body as a patchwork quilt. And each patch of that patchwork quilt will drain to one or two lymph glands in the relevant draining area. So predominantly they're in the groin, for the leg, for the perineum, for the lower half of the abdomen and the buttock. It's predominantly the groin. It's predominantly the armpit for the arm, most of the upper trunk here, up to there, and it's predominantly the neck for the top of the back and anywhere else, predominantly. And having done hundreds of sentinel node biopsies, I can tell you that's pretty accurate. It's often two places, but it's pretty much where they do drain to. So it's the filter system, and it's the and for the skin particularly, you tend to have one or two lymph nodes that drain each patchwork quilt on your body, hence the use of sentinel node biopsy in melanoma. And there's a little lymph gland here, and essentially they look like little kidney beans. They are little kidney beans. You can't feel these kidney beans. Well, you certainly won't feel them in me, but you won't feel them on most people until they're over 1 centimetre in diameter, in longest length. So this bit is 1 centimetre. And when you have scans and things, and you go, well, what were my lymph nodes like? And everyone says, they were fine, there was nothing dodgy or abnormal about them. What they mean is there were no lymph nodes over 1 centimetre in longest length. That's the sort of cut-off point. Now, if you have lots of scans, they might say, well, that one was 5 millimetres and it's now 8 millimetres, but they don't call it significant until it's 1 centimetre. So the lymph comes in one way, it's filtered by the lymph system, and then it goes out the other side, and then that's where it goes round the whole body and it connects up with the venous blood system. So I managed to find one of these. This is what your lymph node is. It's a coffee filter. I don't see many of those anymore, do you? I found them in a drawer. So it's essentially a filter. It filters all the rubbish out. And obviously the lymph node acts well as a filter, but it's connected up with other filters, which is why you can lose 1 or 2 lymph nodes and not suffer adverse effects, because the filtering carries on up the chain. So these are the 3 fingers you need to use to do a lymph node examination. Like Cub Scouts. You can get away with 2, but if you're using 3, you've got more sensitivity because you're more likely to feel things. So use those 3 fingers. You use them in a sort of circular or side-to-side motion. Okay? Don't do this. You're not. Years of teaching medical students do medical student exams. I mean, I have seen everything in that exam. I've seen this. Use the 3 fingers, use as much of the 3 fingers as you can, apply them to the skin. Now, what you're essentially trying to do is you're trying to catch something between those 3 fingers and an underlying hard surface. So, easy peasy on the head and neck in this area, because you've got bones underneath it. And sometimes it'll be underneath muscles, and sometimes it'll be softer tissue than that. But essentially, you're trying to catch something between these 3 fingers. And surgeons, we're much simpler than most of the people you've met so far. So we have to use things that we all understand. So lymph nodes are peas and beans and, sadly, sometimes golf balls or occasionally satsumas. But predominantly, a pea-sized lymph node is probably usually normal, because in a surgeon's head, a pea isn't bigger than a centimetre. But when you get to a broad bean, you're starting to think, it's getting up towards a centimetre in diameter. This is how we describe things. So little round pea-like things we don't tend to worry about too much. Things that are starting to get a bit bigger and a bit bean-like, maybe a bit oval in shape, you're starting to get concerned about. So we're going to start off. So these are the neck lymph nodes. Now, I don't believe you all need to examine every single lymph node group. So if your melanoma was predominantly on the arm, and you had a sentinel node biopsy, and it was negative, or you haven't had a sentinel node biopsy, the likely place any lymph node is going to crop up is your armpit, as I've explained before. And on your leg, it's your groin. And on your head and neck and upper body, it's your neck. So I would concentrate on feeling that area, depending where your melanoma was. If it was the middle of your back, bad luck, you've got 2 armpits and 2 groins to feel. But if it's on a limb, it's much easier. And I think that when you sort of start to talk about stage 3 and stage 4, I think it's probably wise to start getting used to how your whole body feels anyway. Because, again, a very simple surgical mission statement is, if you're taking out small lumps, you'll do better than if you're taking out big lumps. Hence the principle of sentinel node biopsy, hence the principle of diagnosing early, hence the principle of why 80%, 85% of cancer is cured by surgery, because you're dealing with small lumps. And when you find small lumps, that's a whole lot better than finding big lumps. So I think that's probably a good principle. Now, this all looks terribly chaotic and disorganized, but essentially, in the head and neck, I think I'll just talk you through it and then we'll get you up. Is that okay? So just hang on. So in the head and neck, you're looking for lymph nodes, and we're going to repeat it only once. So we're starting off in front of your ear, here. You've got to do it yourself. And then you're going to feel, so in front of your ear you have these little lymph nodes called preauricular nodes, and there's something called a parotid gland, and it's just in this area here. And then you can run yourself down your chin, and sometimes you can feel a little lymph node here called a facial lymph node, but it's nothing dramatic. And then you get to the point of the chin, then you're going to turn your hands round, and underneath here you've got some submental lymph nodes. Try and use obviously you can't use the whole 3 fingers, but use the tips here. And then as you come back underneath the jaw, you get to the submandibular glands, okay? And then you come right into this point, right underneath the jaw here. And then you turn your hands round again. Now here you've got a big muscle, the sternocleidomastoid muscle, and this is where everyone feels when they think they've got a sore throat. And you're feeling all the way down the side of the sternocleidomastoid muscle, this big muscle here. You're feeling for the lymph nodes there, okay? And we're going to go through it again, and then you turn round, and now you're in this big space between the clavicle, which you can feel, the big muscle at the back, and you've got these lymph nodes here. So in that bit of the neck there. And then you push your fingers to the back, to the big muscle at the back, that's called the trapezius muscle. You can go up the trapezius muscle right to the back of your head here, and that's called the occipital lymph nodes, and then come back to the area behind the ear that Andrew talked about, was the postauricular lymph nodes. So in essence, you're doing a systematic run round your neck. And that will pick up all the lymph nodes in your neck. We'll do it again. So the groin nodes, this will probably be easy to show on the model, but essentially there are superficial and deep groups of lymph nodes, but they all lie in the same place. Don't need to get too worked up about it, but they all lie in relation to the blood vessels of your groin. And again, in the armpit, they lie between the 2 big muscles, the pec muscle at the front and the latissimus muscle at the back. They all lie between there. And the principle of the 3 fingers can be used for breast examination. So start at 12 o'clock, go all the way around the breast and end up in the armpit. It's the same principle for breast examination. Lying flat down, you're trying to catch any breast lumps between these 3 fingers and the firmness of the chest wall. So it's exactly the same principle. So when to check? I think the best time to check is, and I agree totally with Andrew, don't do it every week, once a month. once every 3 weeks. I think it's good to do for the ladies when they're putting their moisturising cream on, or do it in the shower when you've got some soap on your hands. So it's a good time to check all the lymph nodes in those areas. Your skin's sort of moist, and things move more easily, and you can give things a real good check. You're, by definition, undressed. So I think you need to ask at your consultations, how do you examine this? And you know, I teach a lot of medical students in the clinic, and the patients absolutely love it. They go, great, I'm getting a reminder. So they sit there and say, yeah, oh, good, I learned a bit there, so how are we doing this again? So trying to learn it at your clinic visits, because one day you're going to be discharged, but you still need to keep a little check on these things. So you've got 5 years to learn how to check your skin and your lymph nodes before you're discharged. Okay? That's how I see it. And then you need to check off that. So I would just, after you've had a visit and everyone's happy and you're all relieved, just give it a little check so you can establish, so you can learn what your body's like, get a baseline, as we call it. And then every 2 weeks, maybe every month, maybe every 2 weeks is a bit of a push. But you know what I mean, not daily is what I'm trying to say. Put your logical hat on. If you've got a rip-roaring cold and a sore throat and you've got a lymph node in your neck, and it's sore, it's probably nothing to do with your melanoma. So give it a couple of weeks to settle down before things come up and things go down again. Cancerous lymph nodes don't come up and go down and come up and go down. So give it a couple of weeks to settle down. You will all have a CNS telephone number. Should do. I'm mortally offended when somebody says to me, oh no, I didn't want to bother you, I rang my GP, it took me 2 weeks to get an appointment, then he sent me in a 2-week wait to the general surgeon, I don't know anything about that. Then I said, well, you've got we didn't like to disturb you. You've got the CNS's number, you've got my secretary's number, you're worried about something, we know who you are, it's a very quick thing to check that and make sure it's nothing important. So you've got the numbers, use them, that's the whole point if you're worried about something. Okay, so let's, can we swap over again? Good, I'll tell you what we'll do. Why, are you going first, Emily? Yeah, why not? Okay. So we'll do the neck, shall we? Let's do the. If we can keep it on. Yeah, and then you can just tie that round your waist. That's all right. And then we can just, am I allowed to just pull it off there like that? That's it. Sorry. I'll do that. Is that all right? Fine. Okay. So just make sure we get. So if you turn that side like that. So this is what I'm prattling on about. If I stay here, just in front of the ear. The reason why you have to look behind your ears is because often you're walking and the sun's behind you. So that gets a great exposure. And I don't know if I'm a bit older than Andrew. When I first started dealing with skin cancer, men always were predominantly right-sided skin cancer, and women were predominantly left-sided. And anyone go on and tell them? Yeah, because it always used to be the men would always drive and the women would always sit in the passenger seat. And so when I first started 20 years ago, that's how skin cancer was distributed. It's not like that anymore, but that's definitely how it all started. So you want to just check in front of the ear, and you're just feeling in this area here. So if I lift the hair up there we go. So just in this area here, there's a little lymph node called the preauricular lymph node just there, and then this is where your parotid gland is. So it sits in there. So this is a really easy area to feel. You can feel there's bone here. You can feel anything, and then you just keep going down, just for the sake of system, and you come all the way to this is where the little facial node sits, just here, just at the angle of the mouth, and then you can come round to the point underneath the chin, and you feel the lymph nodes underneath. They're called the submental nodes underneath the bone here, and then you come back. This is the submandibular nodes here. And then you come all the way back here to right underneath the corner of the mandible. And when we're doing this in clinic, it's important not to press hard on both sides, because then you can cut the blood supply to the brain, which means people faint. and if you ever want to upset one of your nurses, that's the way to do it. So you just press all the way down one side. You can feel you can get your fingers right in underneath the muscle, all the way down to the clavicle at the base. And then this is what I was talking about. Here is the clavicle, the collarbone, here. Here is the trapezius. Shrug your shoulders up. So here is just keep them up for me. So here is the space you're looking into, which is Just down a bit? Okay, let's just try that again. So if you show, can you see the space that we're looking at here now? So there's a little gap made nicely. So this is called the posterior triangle. It's a triangle, and it's at the back. And then this is the trapezius muscle. Just shrug up again for me. And you can see it going all the way up here. So you come all the way up here, and then you get to feel the nodes behind the ear, and then you should always feel around the back to the occipital, sorry, Emily, the occipital nodes at the back. So that will mean you'll have covered all the lymph nodes in your head and neck area. Okay? Thank you very much. Shall I go and... You happy to come up, Neil? Yeah. So my parents are dreadfully proud of me because I've started off doing plastic surgery and I've ended up being an armpit and groin doctor. So there we go. So if you don't, so I think when you examine an armpit, sorry now, when you examine an armpit, so this is the areas you're looking at. So this is the pec muscle at the front here. This is the latissimus dorsi muscle here. The armpit extends down to, well, let's say the nipple, but it extends lower than you think. It's to the end of serratus anterior, but you might be able to see that on you. Never found it on me. Somewhere about here. So it goes lower than you think. And I think the way to get your hand is you put your arm up, and you can't feel anything. But what it does, I might get Neil to do this because it shows you how to. You get your three fingers, you get them right high up in the armpit. You can't really feel much, but then when you bring your arm down, it loosens things up, and you're right at the top of the armpit. Can you feel that, Neil? Yeah. Does that make any sense? And then you just lift your arm up again, and then you gradually, just for demonstration's sake, you pull your fingers down, feeling all the way down here. So that gives you the middle bit. Okay? So you put your arm up, you get your fingers right in there, you can't really feel much. But as you pull the arm down, as it loosens, you can start to feel the tissues become more lax, and you can start to feel the armpit lymph nodes using your three fingers. And then you do the same thing again, but this time you're getting your three fingers. We'll go to the front now. You get them right underneath that pec muscle. So you're now right up here, underneath the pec muscle. And you again, that takes the tension off, and you can really get to feel if any lymph nodes are here, catching them between the fingers and the pec muscle. Okay? That making any sense? And then you do the same thing again, but then you turn the hand round, and then you do the same thing, and you get them behind the latissimus dorsi muscle, and again you relax it down, and you push in hard. Okay? And then just finally you do a final feel, just there. Sometimes there's a couple of little lymph nodes just underneath the arm, just here. Okay?
But you don't feel anything, is that normal?
Yeah. So that's the whole point. The whole point about everything we say is you get into a rhythm of feeling your body. You therefore know there's nothing there, it's normal. Now, sometimes people have fatty lumps in their armpit. Sometimes there's areas around the blood vessels that some people carry a bit of fat, and it's like a tube going across there. And you'll go into your clinic, I'm a bit worried, I've been feeling my armpit, and I'm a bit worried about this, and your doctor goes, oh no, that's your fat around your thoracodorsal bundle. They'll probably come up some claptrap like that. But anyway, it'll just be described as normal. And then you'll go, oh, that's right, it hasn't changed in 6 months, it's normal. But at least you know what your armpit feels like. And if you know what your armpit feels like, then you will be able to know if something becomes abnormal. And quite often, in the early days, some people just always, I've got a few patients with lymph nodes here and there, and they just haven't changed, but that's normal for them. And so some people have a slightly enlarged lymph node in one area or the other, and it's just normal for them. So it's getting to know what's normal for you. Okay? So finally, the groin area here. So are you happy with this, Neil? So what we're going to do is, well, we'll start off at the top. So the top of your groin is this point. It's called your anterior superior iliac spine, or ASIS. But it's the bony bit that you can feel in Neil, and I'm telling you is there on me. And that is the top of your inguinal ligament. And so the ligament goes all the way down. And if you feel down on your pelvis, you can feel the bone of your pelvis. Just sort of down from it is another little bony thing that in men is near where the spermatic cord goes. So it's quite tender, but it's something called the pubic tubercle. So a little bone a little outcrop on the pubic bone, somewhere about here. It's right the way down. So ASIS, pubic tubercle. But if you want to be play safe, just feel for the pubic bone. And that is the inguinal ligament. Now, actually, for people who've got melanoma in this sort of area, you do need to have a little feel just above the inguinal ligament. Sometimes there's a few nodes just above it. But you need to know that that is the important bit there. Okay? Now, I'm just going to see if we can see this in you. Yeah, we can. Great. So now, how are we tense? This is. Oh, that's it. So here you can see. Yeah, we won't both do it. So this is the sartorius muscle. This is called the spinner's muscle because when you sit cross-legged, it's the muscle that you use to move your leg when you sit cross-legged. So this is one boundary of your inguinal, of your femoral triangle. Look out, it goes much lower than you think. Okay? But you can see the space that you're feeling in here. Bone, bone, this space. And you can see it, does that come? I can't see on the camera. Yeah, it comes up all right. And then you can see here, there's another muscle here. This is the adductor muscle. That's the inside of that triangle. So here it all lies. This whole femoral, can you hold that up? That's great. That whole triangle here, from there to there, down there, that is your groin. That is where your lymph nodes lie. And if you lie down on a bed and just tilt your knee out like that, you will create that space. You'll be able to see it and you'll be able to feel it. That's perfect. So you can see that is the whole space that you need to feel in. Now, you can actually even feel your femoral artery. So that's one of the main blood vessels for your leg. But you must make sure you feel along those two muscles and in that space. And again, you're feeling for lymph glands in there. And as I said, thank you very much, Neil. And as I said, what you've got, just feel just above it as well. And that is a groin examination. You know, I can tell you the lateral group is here and the medial group is there, but it doesn't make any difference. That's just the area you need to feel in. Okay, any questions about that?
If you've had dissections,
Mm-hmm.
should you still check the lymph nodes? And also, if you've got lymph to do that, is that obviously then, because I guess the answer is yes, you should. Right, anyway, but if you've got lymph to do that, it becomes a lot harder. What must be there?
So if you've had a lymph node dissection, you shouldn't have any lymph nodes left in the area, and you would be very unlucky if anything else was to occur in that area. But if you've had a lymph node dissection because you actually felt a golf ball or a lymph node was there, so a macroscopic node, okay, as opposed to dealing for it after a sentinel node biopsy, i.e. a microscopic node, you have a slightly higher risk of melanoma coming back in the skin of the groin. So you do need to keep a check on that area, maybe not for lymph nodes, but for lumps that are appearing in the groin, in the scar, in that particular area, so any melanoma recurring. And a lymphedema makes it harder, but it's actually, usually, that bit's all okay, it's just everywhere else that isn't.
Any other questions?
Oh, look at that.
Emily and Neil, you can go and put your clothes on. Thank you very, very much.
Good.